Okay, good evening. I'd like to welcome everyone out to this Beta Sigma event. This evening, we have the pleasure of being joined by a finer woman of Zeta Phi Beta Sorority Incorporated. Tonight, we're going to be joined by Tiffany J. Silman. Tiffany is the Director of Infection Prevention and Control at Chesapeake Regional Healthcare in Chesapeake, Virginia. Prior to accepting the position here, she was a district epidemiologist with the Virginia Department of Health from 2004 to 2011. So now, Tiffany, I'm going to tell you, I'm going to apologize in advance to you and everyone else. There's a lot of big words right here.
That is okay.
So I might struggle through this bio, but I'm just going to put that out there.
That's
I'm
okay.
going to try my best. Ms. Silman received a full academic scholarship as part of oh Lord, I can't.
That's all right.
I didn't go to Norfolk State as part of.
There you go, at Norfolk State.
As part of DENIMAS, a program at Norfolk State. There she became a member of Zeta Phi Beta Sorority Incorporated, Zeta Gamma chapter in 2000, and subsequently earned her Bachelor of Science degree in biology in 2001. In 2004, she received a Master of Public Health degree in epidemiology from EVMS and was inducted into the Delta Omega Honor Public Health Society the following year. She's a board certified. She is board certified in infection control and epidemiology, which is a CIC, and a member of several professional organizations, including the Association for Professionals in Infection Control, APIC, the Society of Healthcare Epidemiologists, SHEA, and Coastal Virginia Infection Preventionists and Epidemiologists, CVIPE. Whew. She currently serves as an appointed member of the Board of Directors for Shared Hospital Services and is a charter member of the Virginia HAI Health Associated Infections Advisory Council. She's a certified trainer in safety and high reliability through press gaining and is committed to zero harm to patients through safe, high quality, patient-centered care. She has served as a preceptor and mentor for dozens of public health and nursing students and is an active member on several hospital committees. Ms. Silman's work in infection prevention has gained recognition both locally, statewide, and nationally. She was selected to be presented at the Duke Infection Control Outreach Network, DICON Education Symposium in 2018, as well as APIC Conference in Philly in 2019. For her efforts to identify and mitigate a significant pseudo outbreak. She has been married to her best friend, Dante Silman, for 15 years, is a proud mother of 4 children, Zion, Christopher, Trinity, and Xavier. She served as the PTSA president at Ready Academy Christian School from 2017 to 2019, and is a member of Second Calvary Baptist Church for over 20 years. In her spare time, now I don't understand how you have spare time after reading all the rest of that. So in her spare time, those few seconds, she enjoys writing and spending time with her family. Her life's motto is from the poem Desiderata, and whether or not it is clear to you, no doubt the universe is unfolding as it should. Therefore, be at peace with God, whatever you conceive him to be, and whatever be yours labors and aspirations in the noisy confusion of life. Be peaceful in your soul with all its sham, drudgery, and broken dreams. It is still a beautiful world. Be cheerful, strive to be happy. Please join me in welcoming Tiffany Silman. Thank you for joining us, Tiffany.
Thank you very much for that introduction. I appreciate it. And I'm very pleased to be here tonight. Thank you so much for inviting me here.
You know, the brothers were talking, we do these different talks each month, and we try to find topics that make sense. And we did ours this month already, but we were looking at everything that's going on in society right now. And we're like, you know, if any time makes sense to do a special one of these lives, it would be now. So the topic we wanted to talk about tonight is how does COVID affect your travel and everything going on during the holidays? Now, as I read through your bio, your resume is so impressive. You've done a lot. You're well credentialed. So we appreciate you spending your time with us tonight, because right now there's so much that we're being told, be it social media, be it the news even.
Yeah.
But from your point of view, with your expertise, what would you say is the real state of COVID here in Hampton Roads?
Well, right now, you know, at one point during the beginning of COVID, you know, we had a steady stream of numbers. And then in the summertime, we really saw a surge. And then we had a little bit of a decrease. Now, since we starting to the holiday season, we're starting to see that increase in numbers. I mean, as of today, we have about 300 and almost 320,000 cases of COVID in the state of Virginia, close to 17,000 hospitalizations and almost 4,700 deaths just in the state of Virginia today. And those numbers continue to climb. And so even here in Hampton Roads, we're starting to see those numbers go up within the hospitals. The census is going up. And so we're starting to see that so quote unquote second surge that we saw in the summer come back in. A lot of that we contribute to, of course, in the summertime is a little bit easier when everyone can physically distance. We're outside, we can do cookouts. And now as we get closer to the winter months, we anticipate that some of that surge is going to be because now we're in enclosed spaces and things like that. So right now, I can say in Hampton Roads, in just state of Virginia period, we can definitely anticipate an increase in cases and daily we see that happening. So it's almost like we need to brace ourselves for definitely that second surge that we as epidemiologists anticipated anyway. From the beginning, I said we haven't seen, it's like holding a collective breath, so to speak, waiting for this to come. And I knew around November, December was probably gonna be the worst months. And of course now, as I anticipated, we are seeing that. So not just, of course, here in Virginia, but just nationally, but definitely here in Virginia. Absolutely. So.
Well, it's interesting. You talk about that second surge. My kids actually have been attending school in person for the last month or so. And, we made that decision to send them back in for their second quarter because we were seeing very little cases or schools. Right. I mean, I took them up there for a test, couldn't get past the front door. I wasn't prepared for that. I had to go find me some coffee or something. So, I see them taking those precautions and it worked really well. However, I say, after Thanksgiving,
yes,
we started to notice a change. We started to notice an uptick. We got a couple of emails from the school talking about we had a child test positive, we had an exposure case, we had things like that. It is a travel time now. Typically, this is the travel time right now. Mm-hmm. I know in my office, a lot of people started vacation today. I already told my team I won't be there next week. I'll be right here in my house.
Exactly.
Doing a true holiday staycation.
Right.
I'll play with my new toys, is what I'm telling them. But with people who are looking to travel, I'm not sure what to really expect. Are we going to see yet another surge when we come back? I mean, what are your thoughts on that? And what do you think with regards to holiday travel this year?
Well, I'm going back to the point that you made about Thanksgiving. And like I said, from the medical, where hospital level, we kind of held a collective breath because we knew when Thanksgiving came, everyone was going to gather. And we knew within 10 to 14 days after that, well, actually 7 to 14 days after, we knew we were going to see those increase in cases. And such is the case now with going into Christmas, is that what we're seeing a lot of is just the gathering. People have, I think at one point we talked about pandemic fatigue, where everybody's tired. I don't want to be away from my family. I've been away from them for 9 months, 10 months. I want to see, I don't know, this might be grandma's last holiday, but it might be your last holiday if you with grandma, So I think that as we get, we've been doing this now for almost 10 months and everyone got close to the holidays. Like, what, I'm just tired I'm tired of masking. I'm tired of not being able to see each other. We're just going to do it. And unfortunately, what happens is that you start to see those surge in cases as the holidays start to come in the next day or so, and then going to the new year. I anticipate that these numbers are going to go up. We have a lot of messaging with people, and we ask people, and I don't believe in social distancing. I always say physical distancing because I know we're social creatures by nature. And so to socially distance from somebody is not realistic, but to physically distance from someone is really the ultimate goal. But as the holidays come, everyone feels like, and I think especially in the African American and I think people of color, we tend to want to be around people. We tend to want to be around family, very family oriented. In the beginning of the pandemic, what we were seeing, and even now so, is that especially when you have a large family, it's not just one person that gets sick. A lot of people have multiple people. I mean, even within my house, I have 7 people. So if one person gets sick, it's not necessarily one, it's 7. So you see that large number of people getting sick because we just have a large family. And so that that coupled with the need to just gather, and which is natural, just to want to be around family, has really precipitated those numbers going up. So I think it's a combination of this pandemic fatigue that people are feeling. I'm just tired of doing this all the time. I just want to see my family, coupled with just the large number of families. And then, you know, all those things have been contributing to that. So we've seen that. I anticipate that's going to go up. I anticipate the numbers are going to continue to surge. I think that we're going to see the worst of it probably in January, beginning of January, probably beginning to mid of January. We're going to see high numbers. We're definitely going to see high numbers. So in terms of, I think I'm sorry, I think you were going to ask the question.
No, please continue.
Well, and I think I just want to just talk a little bit about holiday and travel. So everyone wants to travel for the holidays, and you know, CDC has some great talking points about traveling. First thing they say is they're discouraging people from traveling abroad. You know, you really don't. If at this point in time, really, we want to try to discourage any unnecessary travel, non-essential travel. Traveling puts people at risk for a number of reasons. One is because if you're on a flight, just the mere fact of being the security lines, the terminals, being in close proximity within in the plane itself is very difficult. You can't physically distance in a plane, but even with a mask and other things, it's very difficult to distance from people. And so we know that puts you at risk. People are touching things. If you've been on a plane, people are sneezing, you know, they go to sleep. Next thing you know, the mask is slid down. So they're like, you know, you're next to, you know, Sam, and he's half asleep with his mask down, you know, leaning over and you breathing on you. But, you know, in honesty, it's just very difficult to distance. And so that puts you at higher risk. Again, people are touching things. We have a tendency to put our hands here and on our face. And those things put you at risk. The other thing is that, you know, of course, where, you know, planes do circulate air, you still have some, you know, it's still circulated air. You still have the air circulating in that plane. And so, you know, they do have HEPA filters and they do have those things, but you're still in a very enclosed space. And so the combination of that with the flying puts you at higher risk. When you travel, you're also traveling to places where the numbers can be higher. And so there's other places that are not as strict. So different states have different, you go to some states and you're like, okay, are we in the middle of a pandemic? Because nobody's wearing a mask. Like what, like, all right, y'all in the same place I am because nobody's wearing a mask here. And when you go to other places and everybody's masked up and you're looking at you like crazy if you're not washing your hands. So, you know, different areas have different restrictions. And so, you know, while we all encouraging people to mask, like I said, you know, if you go somewhere else, you may not be in that area where we're doing those infection control practices as you would do sometimes here, and especially abroad. You know, we have a different subset of standards as we do abroad. So we want to, as much as possible, you really want to reduce non-essential travel. And I know a lot of people already have their travel plans in place, but you know, I really admonish you all for the holiday season, if we can physically distance as much as possible so that we can be here for the next holiday season. I can't say that enough. I really can't say that enough. And I think the main thing for, you know, and from my perspective is not the people who are sick and coughing, because, you know, everybody's sick and coughing. You're like, yo, you need to back away. Like, okay. But it's the people who are not sick. And it's the people who are asymptomatically positive. It's the people who are pre-symptomatically positive. So 2 days before you have COVID symptoms, you can spread 48 hours beforehand. And again, the asymptomatic one. So I'm perfectly fine. Or, you know, I may just feel like, you know, I had a little bit of headache, but I'm good, you know, and then you end up still being able to spread. That's what's happening. That's what we're seeing. And it's not, because nobody, I mean, like I said, you're not gonna be around somebody that's coughing and sneezing and hacking, like, you know, come over and let's go watch the game. Like, nah, you need to stay home. But it's the ones that are asymptomatically positive. And that's what's happening. Even when people travel in families, you have one person that seems to be fine. You know, nobody was sick when you know, everybody was, you know, put the mask down. You know, everybody was fine. Like nobody was sick. You don't really have to be sick. That's the thing. You don't have to be sick. And then I think the other thing is that some of the things that I hear from people, some of the barriers are sometimes families get very offended. You come in my house with a mask on, like I'm family. Like you don't want me to, you know, why do I have to wear a mask around you? You know, and so people are afraid to ask people when they come into the house, can you wear a mask? Can we distance? Nobody wants to do that. They don't want to do that. So, you know, it's all those factors of the asymptomatic person, and I don't want to wear a mask, we're not good like that. You think I got something wrong with me? You might, I'm thinking to myself, there's a good possibility you do, and we're at the point literally that we have to treat everybody as though you have it. We're not even at the point now where we can relax, like, nah, because COVID is not like she has COVID, it's around. You don't know who has it. You do not know who has it. And as these numbers rise, we're seeing more and more people that seem to be perfectly fine and still spreading. And that is the scary part.
You made some great points right there. One of the first ones was like wanting to get out of the house. Yeah. I laugh, and especially when it started this spring. Yeah. And the amount of time I had to spend, let me watch my words, the amount of time I got to spend with my wife and kids was triple what it normally is. And I learned that, I love my kids. There's a lot of times I do not like them. Yeah. So that desire to get out of the house became very prevalent, and finding ways to not have cabin fever. I know even within the fraternity, I think every single one of us bought 2 or 3 bikes, it seemed like, and going for bike rides and finding ways to get healthy, to try to get rid of that COVID 30 pounds we were putting on.
Yep, everybody got it.
Oh yeah, but I ended up putting on 40, so that's another story.
That's about the right number. That's about everybody.
So when we get back to the talk about the holiday travel, I've had to travel quite a bit for work.
Yes.
And I've had to get tested before, multiple times actually, and have team members of my team tested. What is the best thing we can do? Because sometimes you don't have a choice. Sometimes you have to travel. Yes. What are some best practices we can do to prevent or try to lessen the chance of catching COVID or spreading COVID?
Well, there's a lot of, so CDC talks about some of the things you can do before you travel. So they say, 1 to 3 days before you travel, you can get, as far as testing is concerned, you can get tested 1 to 3 days before you travel. And then after you come back, you can get tested again 3 to 5 days. And then really try to limit what you do for the next 7 days, even if you test negative within that 7-day period after you come back, just kind of lay low with that. If you don't get tested when you come back, for the 10 days after you come back and travel, just really try to limit your activities for those 10 days, just because you just don't know whether you've been affected. If testing is not an option for you and you have to travel, I think ensuring that no matter where you go, you always have a mask. That is not even you have to have a mask on. Making sure you always practice hand hygiene. Bring things with you like wipes as much as possible, Lysol wipes, any kind of wipes that you have, and wipe down surfaces if you have to stay in a hotel. Distance yourself, as if you can limit the number of people. I know a lot of times, like, within many organizations, the limit now is 10 people. But even when you're sitting, if you have if a business travel, in your meetings, of course, distancing yourself between people, limiting the number of people that you eat lunch with, because a lot of times, even in the, not even travel, but even in the workplace, we see a lot of transmission in break rooms where people are eating because they're taking their mask off. And of course, that's where people are eating. So, even if you have to travel for business, these are people that you don't know. So if you can try to eliminate some of those business lunches, and I know it's, everybody's like, well, really, can I do that? But you really want to try to limit as much as possible, because that is really a direct way we can, transmit from there. But again, always carry hand sanitizer no matter what. If you're traveling, don't be afraid to whip it out, because I whip my out. It does not matter where it is. They're like, tip, I always got hand. I got sanitizer. I feel like a pusher. I'm like, I got what you want? What kind you want? I got everything. I got
that good stuff.
I got Purell. I got everybody, but always keep that with you. And then, like I said, mask etiquette, and then respiratory etiquette. So, maintain your mask, trying not to touch your face a lot. I know people like to do that a lot. Keeping that mask clean. So even whether you're traveling or not, I suggest that if you're traveling, and you're not in a place where you can wash your mask every night, because you're traveling, whether it's wherever, get disposable ones, get the ones that you can just throw away. But I tend to use those anyway, only because that's a whole nother talk about masks. But if you travel, try to get the ones that you can throw away, because like I said, you may not be able to be in a place where you can wash them. And you really should wash those. You really should wash them daily when you come home, and wash them and have them hang up and dry. But if you can't, get something that you can throw away. So those are some of the tips that I think that if you have to travel, do that. But, you know, if you, like I said, if you can't get tested, just make sure good infection control practices. And really, when you come back, limiting as much as you can do, and just watch for signs and symptoms when you come back. The other thing that I push people, if you haven't gotten your flu vaccine, we haven't seen, believe it or not, I mean, I'm knocking on wood here, you know, we haven't really seen any flu in the community, but you still want to have another layer because you definitely don't want to get flu and COVID. So if you can protect yourself in another way for another respiratory illness, if you haven't gotten your flu vaccine, because there are other places in the United States and other places abroad that there is flu circulating. So you don't want to, if there's one way that you can limit another type of infectious disease process, which is flu, and keep yourself as healthy as possible. I do, if you haven't gotten your flu vaccine, it's still available at your local pharmacies, and most of them will get paid through your insurance. And there's even some free flu shots. You know, do that. Try to eliminate the many factors that you can to keep yourself as healthy. But good infection control practices when you travel is always going to be key, always.
Well, I really appreciate that feedback, especially on the mask wearing and the disposable mask while you're traveling. I never really thought about that. I mean, I usually carry my 2 masks, my comfortable ones, you know, the Under Armour and the Adidas ones, just because those are the ones that are easy for when I'm flying. I never thought about the fact that I might be gone for a week and don't have the opportunity to wash it like I normally do. So that's really great tip. So one thing for anyone who's watching us right now live on Facebook, please leave comments and questions in the chat. If we have the time in the end, Tiffany's definitely do her best job to answer some of these questions for you guys. And actually, one of those questions relates to really what we're talking about right now. Steve Cooper was asked, or I'm sorry, Steve Gohana was asking, vitamin D is something that he heard was recommended to be taking. Is there any truth to that, or is that a wives' tale that vitamin D will help during these times with COVID and with just respiratory problems overall?
Now, I'm not a physician, so I can't say. I do say that they do push, there is some benefits to vitamin D. And so I can say that I know that a lot of the physicians are pushing vitamin D as something that will be beneficial. So I would definitely say that that's not something that I would say yes, definitely. What I do see a combination of when I look at the orders for our COVID patients, I do see a vitamin D as one of the things that they do push. So I would agree to that. But like I said, I'm not a physician. I don't play one on TV. So I don't want to give any medical advice that's outside my scope of practice. But as far as I know, yes. Yes.
Okay, great. Thank you. Yeah. And you know, that's one of those things that sometimes we don't pay attention to and think about is the vitamins and the supplements that you should be getting into that aren't coming in our diets naturally. I mean, I feel like I'm on the episode of The Wire sometimes with all the stuff I'm taking in the mornings just to get my day up and going.
Yes.
Vitamin D is in that, my fish oils, my blood pressure pills, because I'm an old Black man, all of those. Just gotta make sure I keep it all there so that I can do that a little bit better for my body.
Absolutely.
Now, okay, so a big topic that's going on right now within COVID is the FDA's granting these emergency authorizations for these vaccines.
Yeah.
I kind of wish they had waited till after the holidays to grant these, because, you know, a lot of people hear this and they're like, oh, I'm good now.
Yeah.
With a vaccine, I can just go out there and do everything. Let's hit the spot.
Right.
Let's go to the club. How do you see that these vaccines impacting the general populace and even the Hampton Roads community? I know that the first nurse got her shot a couple of days ago, and they've had a second supply come in. How do you see that affecting our community?
Well, first thing I'm going to say, I'll put it out there that you know, people ask me, am I getting vaccinated? Absolutely. I will be getting my vaccine tomorrow, so I am getting vaccinated. And the thing is that, you know, this is the way I feel about it. You know, vaccine, the only way that we're going to get through this pandemic is through vaccination. There's only two ways we can do to get herd immunity. So herd immunity is basically that we need to have enough people that have immunity so that the people who are susceptible don't keep running into people who are also susceptible. And so we have to protect these susceptible individuals. And the only way we could do that is to protect them by everybody being immune. The only way you can get immune to something is either by getting disease or by being vaccinated. So the whole point of us, when in the beginning of the pandemic, we talked about flattening the curve. What are we flattening the curve for? You know, what does that even mean? Like, I don't even know what does that mean? You know, we flattening the curve, meaning that we want to limit the number of people who are getting disease at one given time so that we don't exhaust our resources. Imagine if everybody got COVID at one time, it's going to spike like this. Hospitals will be overrun. People are going to die. We don't have enough vents. We don't have enough medication. We don't have anything. And the curve is going to go here. Flattening the curve means that a couple people get disease and then you recover. A few more people get it and then they recover. But what the point was, we're waiting all that time to get to where we are now, which is vaccine. We're buying time. We're buying time until we can get to the point where we get vaccinated. And so vaccines are going to make a huge difference. And I know there was a lot of people have a lot of questions. It was made too fast. What in the world was going on? Is it injected? Somebody they're putting in something in there. It's going to inject inside of me and they're going to follow me around. And I got a little chip inside the vaccine. I'm like, you got a chip in your phone, honestly. And all those things are not true. The only way that we're ever going to get over this pandemic is through vaccination. And it's going to be a little while, but we need to get enough people who have immunity to this particular, to COVID, to actually get over it. And I think that, everybody, and including myself, I'll be very honest with you, in the beginning, when they talked about the vaccine, first thing I said is, I ain't getting it. And as I talked to a lot of the other people, even physicians I talked to, they was like, we ain't getting it. And most of it was because, the government hadn't released anything on it. It's like, we got a vaccine and it'll be in December. We're like, all right, well, where's it from? How you make it? What does it do? What are you talking about? And then they had Operation Warp Speed. Like, that's like the worst name for it ever. Like that made it even worse. Like, I know I ain't getting it because I don't know what they did to it, So I was already like, nah, I ain't getting it. But then, as they started to get more information, and FDA came out with some stuff, and Pfizer came out with their effectiveness and efficacy and how they developed the vaccine. I can tell you that the vaccine is developed safely, that it has been effective. That is the what we've seen so far is that it has been effective, and it's something that we just what we have to do. The only way, and I think that when more and more people start to get vaccinated, you're going to see this pandemic slowly but surely. We're going to see less and less numbers of people, and eventually that's the only way that we're going to stop the pandemic. We're going to get those numbers down, and more people are going to be immune. So I know that is a hot topic right now. The FDA approved Pfizer first for healthcare workers 1A, and then Moderna was just approved over the weekend. So those two vaccines are the first ones that are out. And most of the hospitals that have been in the state of Virginia, the hospitals have been issued Pfizer. And so that's for the healthcare workers in the health community. And then Moderna will be coming out for distribution very soon. And so, like I said, I will be getting mine. I think that we have to change our way of thinking about vaccine and how to get over it. And I know one of the things that I say is that, we pray and pray and pray, how do we get over this? Lord, send us a sign, send us something, how do we get over this pandemic? We always pray that it gets over, and then he sends us vaccine. And so there is a way, this is our way. And if you believe in science, we have to put our political differences aside. We have to put everything aside. And he sends us scientists who spend their life dedicating to doing this and to vaccinating people. And so this is our way out. This is the way we can do it. So I think that's going to make a huge impact on the pandemic. And, I foresee the next year and a half, 2 years, when it starts to become available. Of course, in the next couple of months, it'll be available slowly but surely out to the public. I think right now we're in the healthcare workers and some of the higher risk groups, and they'll just start rolling it out. And that's just based on the limited use we have right now. But in the next 6 to 8 months, it'll be, I'm sure, widely spread, widely available to everyone. And then, we'll start to see those numbers start to decline as more and more people start to become immune. So there's so much more to come, but I will tell you that this is our way. This is what it is. So.
I find it interesting. You talk about how some of the politics behind it and how it became politicized, and even the name Warp Speed. I mean, as a marketer, I think that was a horrible idea. I agree with you. Let's go as fast as we can. We didn't say we're going to go right speed. We said we're going to go warp speed.
Yeah, that's even worse. That's worse. Yes.
And then what I find hilarious about that, though, this is putting my political science hat on slightly, is Pfizer wasn't even a participant in that. So they were able to develop theirs separate from the government and the politicizing of it, and they still were one of the first to come to market.
Yes,
with a viable vaccine. So it just goes to show you that, the politics aside, these companies were putting in a lot of work, and this was a worldwide effort, not a just United States effort. As we hear and see, I like to say lenses and blinders. Our blinders are to the U.S. and what we are doing here. These are multinational companies spending billions and trillions of dollars to make this happen. So those, I trust them much more. I will never ask one of those doctors and scientists to run an ad campaign for me. That's what I know. What they know is how to create a vaccine. So I will defer to them on that. So we had a few more questions coming in. One of them that is interesting, it's also about the vaccine. And this might be more of an opinion than anything, is should Black people, or what advice do you give to the Black community? Because there's distrust amongst our community. I find it interesting that a lot of people will quote like Tuskegee experiment, where Blacks were in fact not given the vaccine and given syphilis. So a lot of us don't know the full histories of it. So the vaccine would have in fact saved us. What would you say to our what would you say to our community?
It's funny you say that. I'm like, yeah, is that the reverse? But anyway, yeah, I would definitely say, and I know there is a lot of it, definitely. I would say that we as Black people need to get the vaccine. I think that again, like I said, oh Lord, what are we gonna do? I hope we get over the pandemic. What are we gonna do? We ask and we pray and we want to get all this stuff, and then we get vaccines and well, I ain't taking it. Why? This is your way out. We have a tendency right now in the beginning, if you look at the stats and demographics of COVID, we were disproportionately affected by COVID. And it's not necessarily because it wasn't an economical thing. I think people want to say because it wasn't they didn't have access to care. No, it wasn't. It didn't have anything to do with that. People who had insurance didn't have insurance, had different whatever. Whether you made $100,000 or $10,000, you still end up getting COVID as Black people. So what does that mean? It's not access to care. It's the fact, again, going back to our sense of community. What I see a lot of times is that when I'm in the hospital, it's families. There are more than one person coming in. It's because we tend to be together and congregate. We tend to have the, I'll come and visit you. If I'm sick, I'm not gonna come see you, but because I feel okay, I'm gonna see grandma. Well, you feel okay, but you're asymptomatic and now you've given it to grandma. So that whole sense stronger of family tends to want to bring us together to gather. And because of that, we've seen a lot of spread in that community, a lot of other things. And then of course, that coupled with just our natural of having underlying conditions and being prone to more underlying conditions, we're at risk just by some of the things that high blood pressure, things that we know Black people tend to have. And those are the risk factors that can make us have a lot of complications with COVID. And so I think the coupling with, the underlying conditions that we have, coupled with our strong sense of family, we have to put all that aside, skepticism aside, and say, okay, what can I do? And, for me, maybe I'm going to be okay. Maybe I'll be fine, but my mom is not going to be okay if I get COVID. And would you ever forgive yourself if you had an opportunity to get vaccinated and you didn't, and you brought COVID home to your family? Those are things that we have to consider. So I know there's a lot of skepticism, to see all that kind of stuff. You have to remember that when they did these clinical trials, it was on everybody. As a matter of fact, we probably needed more Black people to be in the clinical trials than we did. You know what I mean? Because most people don't want to do it. But at the end of the day, COVID don't care. I'm gonna tell you, COVID does not care who you are. We just, so I don't think that, I think we need to put all that aside. I think we need to put all those racial things aside and realize that we need to show up. We need to get vaccinated. We need to protect our family. We need to protect our elders. We need to protect the ones that are susceptible and cannot get vaccine. We have a tendency to have things like lupus and a lot of the autoimmune diseases that run sarcoidosis, some of the things that are prominent in the African American and Black communities that may make our loved ones not able to take it. And so again, you want to cocoon those people that can't. So if you have someone, I have someone very close to my family, I have 2 members that have autoimmune diseases, they are likely not able to get the vaccine, but I can, so we just have to start changing our way of thinking. This is what we have to do for our health and for our family. And just like you will go out and for your child and stand in front of a moving train to protect your children, that's the way we need to think about what can I do to protect my family. If getting the vaccine is what's going to do it, then that's what I'm going to do. We have to change the dynamic. We have to change how we think about protection of our family. And for pandemic right now, like I said, right, we can almost I assume everybody's positive. And so if we have like I said, Black families, have that discussion, talk about it, educate it. Wait, don't sit around with CC and boo boo and whatever and say, I ain't getting it. So let's talk about it. Go to CDC, go to WHO, go to different, so the Virginia Department of Health, go to some trusted resources and have educated conversations about when the vaccine is available, how do we feel about it? And I really feel like as we need to go out there to protect our family. We have to be frontline and protect our families. So that's my feeling on it. And even more so, if I can encourage any group of people to do it, because I know that we disproportionately get it and disproportionately do worse if we do get it. It is Black people and as a whole. So we have to encourage everybody. Absolutely.
Yeah, and I joked earlier about the fact that I have to take all these pills. I'm on blood pressure, but I'm third generation of my family taking blood pressure pills.
Yes.
Because as a community, we have a love for high cholesterol, high salt foods. I fried gizzards last night. I mean, I'll admit that. But I knew that I couldn't eat as many gizzards as I would have before.
Right.
And I had some tuna steak beside it to go with it. So you learning, and often we talk about communities of color are disproportionately affected, but that's only one of the demographics of it. It's also lower income communities where we are dealing with food deserts and all these other problems, who don't have access to as healthy of food, which in turn leads to poor diets and poor health.
Yes.
So sometimes we have to remember that it's not just that we are people of color, it's the choices we're making. And I can afford to eat better than I do, but that's what I grew up on. That's my culture. That's my family. That's that comfort food to me. So that's something that we all have to think about. And you mentioned one of the things I like to say: a small bit of sacrifice can lead to a long time success. And that's really what we need to look at. I laugh at our society overall, because how often do we still complain about having to take our shoes off to get on a plane? Back during the World Wars, kids were turning in their toys and their red rifles and the red flyer wagons so they could be melted down to make bullets. They were making true sacrifices. And now we're complaining that we're not willing to sit in the house and watch our 60-inch TV and the 13 different streaming services and the AC and all this food and have our stuff delivered to us. Everyone's doing free delivery, but that's a problem. We have the right. We also have the right to help our communities, which is, I think, what's even more important. So let me check to see if we have any additional questions. See, I think we answered that one. This one, so do you have any knowledge about, and this is probably still too early to even say, what the longevity is of the vaccine? Some saying that it's not a lifetime vaccine. I mean, we get, well, I say we, some of us get our flu vaccines every year.
You should.
I've been at the Army for about 15 years, so I don't think I've had one in about 15 years.
All right, well, we're gonna say not too late.
It's not too late.
It's not too late. It's not too. Right now, it is too early to say that. I foresee that this will it will likely be something that we'll have to get annually. There's going to be tweaks. There's going to be strands. It's probably going to mutate, just like we do flu. Flu has different strands. I foresee that we get 2 doses. So the vaccine is 2 doses. Well, Pfizer and Moderna is 2 doses. Some of the ones that's coming up can be a 1-dose vaccine, but we'll just see. But it's very, very early because, again, I think that it's going to mutate, and we're probably going to either have to do something annually, or they're going to add a strain or something just like flu. So we're just going to see. It's kind of early to see, but I don't think it's going to be like a one and done. I don't foresee that.
Yeah, I mean, I think as I was driving home tonight, I heard that there was already a mutation, COVID-20 in Europe that they were identifying.
Yes, I did see that. And I'm not surprised. I'm really not surprised when you go with these coronaviruses. And I think what people don't understand is that, coronaviruses basically it's a large family of viruses that have been around forever. Coronavirus is not new. This one is a new strand. And so we have to understand that most of us have, coronaviruses. There's 4 different types that actually live in the human respiratory tract. And most of us probably had one of those 4. We have the quote common cold. Common cold is probably made of about 200 different viruses. This particular COVID-19 is novel, but because it's a new strand, but the coronavirus itself is not. And so, we have to remember that, things change, they mutate. Just a little bit of, and I like to give background and stuff because people are like, oh my gosh, coronavirus is, it's brand new. It ain't brand new. You think about, this is a SARS-2. So the actual pathogen that causes COVID-19 is called SARS-2. Most coronaviruses, and actually all coronaviruses, are zoonotic, which means that they start from animal source. They start from animals and they go to humans. So, talk about avian flu, and we talked about, swine flu. All of these viruses, most of them start, Ebola started with bats. Corona started with bats. SARS-1 started with bats, and then they went to civets. I don't know if you got with civets, they're cute little things, they're cute. And then it went to humans. MERS, Middle Eastern Respiratory Syndrome, started with bats. It went to camels, and then it went to humans. So, these zoonotic illnesses start to mutate as they go from animal source to human source. And as they mutate, they change. So viruses, like, we talk about coronavirus, is it going to be the one and done? Probably not, because they do change. They mutate as they go from different sources. They're going to mutate. Likely this coronavirus came from a bat. There was probably another source in that Wuhan city where it first started. In that marketplace where it started, there were animals in that marketplace. We don't know which animal it was that probably was there. And then it went to a human source. As we start to bridge the gap between humans and animals now, many years ago, human was here, animals here, because you ain't gonna eat me, and now we have, I'm like, was that an exotic, I don't even, links in your house? Like, we have all kinds of weird things, like, why is that in your house? But we're bridging that gap closer and closer. So of course we're gonna have some of that, there's gonna be mingling, transmission between humans and animals. And that's why we had, it's like, oh my God, I can't believe the dog and cat got coronavirus. Don't be surprised. They get, we get, animals can go back and forth, with different things. You can get MRSA, your dog can get MRSA, staph infections, and they go back and forth. So as we start to get closer, we're going to see more of these zoonotic illnesses transmit to humans. So, and they mutate, and viruses are there. They are some funny, tricky things. And so, like I said, I foresee so much change coming up with this virus that, we just got to watch and see, what does it do? I think the vaccine is a very, very good step, because at least your body's gonna start recognizing, that it recognizes it, like, okay, I've seen you before, so I'm gonna start producing some antibodies. But I don't think, like I said, I don't think it's gonna be a one and done, just because these little tricky things, they will change and mutate in a second and then end up being something else. So, so much more to come on this. So that, that's my little history lesson on coronaviruses and where it started. But I just want people to know that it just didn't come out of thin air. This is, there's some history behind it, and we'll continue to see this. This is not the first nor the last that we'll see of these zoonotic illnesses that end up being, hopefully not to the pandemic level, but will definitely affect us as humans. So with more to come, so much more to come.
You're definitely blessing everybody with some knowledge right there.
Yeah.
I'm telling you from the comments, everybody's like jaw drop right now. Like, wait a second, is that how it worked? Everybody thought it was funny when they were watching Tiger King a few months ago.
No.
Yeah. Let's have all these animals around us. Well, we see what happens when you have all these animals that aren't supposed to be around us.
Nope, that's no. So, and it's going to happen. We just have it all the time, and that's what I was telling them. You think about things, all the vectors that we have. The most dangerous thing in the world, actually, I tell people, is a mosquito. That's the most dangerous thing in the world. Not a snake, not a whatever. It's a freaking mosquito. That's
why I got skin so soft, so I'm good.
That's right. That's why I got skin so soft from Avon. Avon still selling too, and that's the best thing. But you think about it, how many things that they can carry there. They can carry all kinds of viruses, all kinds of things. And so these little vectors come and they just transmit, and they get somebody, little thing in between, and you just go from humans. So just, that's the beauty of what I do, because I never really, I always keep learning, because you never stop with infectious and communicable disease. Always changes. There's always something new. But like I said, this is not new, but we'll see more. I think my message now is just, even with the COVID virus and even traveling for the holidays, what we're doing now are things that we need to do anyway. You should always be washing your hands. I said, I've been doing this for 16 years, Lord. My messages haven't changed. Listen, Tiffany, what's the message for everybody? The same thing I've been telling you for the last 16 years as I've been doing it. Wash your hands, cover your cough, stay home when you're sick, wipe down surfaces, you protect yourself, stay away from people if they're sick. It's the same messages now that it had, that it's always been. I'm hoping that even as we move through this pandemic and things start to roll back, people won't stop doing that. They won't stop carrying sanitizer. They won't stop wiping down surfaces, because I can tell you there's things that are far worse than coronavirus that's out there. You have multi-drug resistant organisms that are resistant to every antibiotic, and you cannot do anything. There's no treatment. There's no treatment for it. There are things that scare me, that things keep you up at night. There's a lot of things that keep you up at night. And there are things that there's no cure for. There's no and so we have to understand that we live in a world where we just have to do these good infection control practices in order to keep ourselves safe. And so the message is always the same, no matter what, with these infections. Just keep yourself safe. Use the same tools that we've always had. Sanitizer ain't new. Soap and water ain't just come out. All these things didn't just come. Those same messages I'm hoping will carry through the rest of this pandemic, especially in the holidays. I will give this message. Anybody comes to your house, I tell a story all the time. You want to go to somebody's house, go into their bathroom. If they don't have soap and they don't have paper towels in there, walk out, because how you wash your hands and wipe your hands down when you go to the kitchen and you're making something and you go to the bathroom, that ain't good. We don't want that. You always want, so you always, in my house, I could have no food, but I will have soap and paper towels in my bathroom. There ain't nothing to eat, but I'm gonna have that in my house. I'm always gonna have soap and paper towels. But just those things are very important, of making sure that you do that. You go to people's houses, don't use the towel that they have in their bathroom, because everybody's used that towel. So you're contaminating your hands by using that same towel that everybody's used, and then going out and eating. You're just eating whatever they have, because people don't wash their hands well, so you don't know what they put in that towel, and now you're gonna put it in your mouth. That's a whole nother talk that I can do later, but those safe practices that you want to do, like I said, COVID is one thing, but just good infection control in general is going to protect you from other things. You want to keep yourself as healthy as possible. And that's, just those practices are going to just carry through. So no matter what.
That's a funny and scary topic or a point when you think about that.
Yeah.
How long, why was it such an amazing thing for people to learn how to wash their hands, for people to actually carry hand sanitizer and have that readily available?
I know.
I'm lucky I work in a construction office, so there's a lot of dirt, so we have to keep stuff clean all the time, especially for those of us on the administrative side. But I think about so many places where you never would see hand sanitizer.
No.
And think about the fact of how quickly people go in and out of the bathroom. You didn't wash your hands?
Nope.
No, you didn't. You didn't get in between the crevices and everything. Nope. You let the water touch the top.
Yes.
that is scary. So Tiffany, we're getting close to the end of our hour. Yes. There's one other question, which was going to be a question I wanted to ask you.
Sure.
We talked briefly about this earlier, about all the misinformation out there.
Yeah.
Where would you suggest people go if they want to find out the truth and more information about what's going on with COVID?
I would definitely suggest that you go to the CDC website. They update that website, I think, almost daily with information. There's information. They break it up into groups. Healthcare professionals frequently ask questions. Schools, businesses. They have data, statistics, anything you can possibly think of. Travel. There's sections on every single thing that you can think about COVID. There's a whole thing now about vaccines and what that means, and they can break that down. Not only do they have that, but they also have links to other places where you can click on, and Pfizer, and for WHO, which is World Health Organization, and other places that you can click on and get more information. So I always start with CDC. I can tell you at the hospital level, no matter what has happened and what the administration thinks, CDC, Centers for Disease Control, will always be our source of truth for us. It has been for as long as I've been in what I've done for almost 16, 17 years, and it continues to be the source of truth. They have some great information on there. Like I said, any kind of question you could probably think of is on that website. If you live in, of course, Virginia, the Virginia Department of Health, they really have information and data that's for all the way down to locality level. So you want to see how many cases are in your city, how many hospitalizations and things like that. Virginia Department of Health, if you Google that and look at that and look at COVID, they have vaccine information. They also have the same type of thing, travel information. So that's a little bit of more of a smaller scale because it's here for local level. So CDC is, larger, and then VDH. I would start with those two sources. And then again, they can go out and they'll click on other links to other places. But those are the trusted sources of truth that I would definitely, that's where you go. And so if CDC doesn't say it, I know we got a lot of social media and, mamaslappapa.com and all stuff. Like, I read this alone. I was like, that ain't, where you get that from? No, no, don't listen to that. You don't want to do that. I think CNN also tends to be very accurate. I would say that when they report things, I do look at CNN, and NPR has a tendency to be pretty accurate. But I think the source of truth, if you want to look at it, will definitely be cdc.gov and Virginia Department of Health.com. Those are two sources that I always look at. And if you're not here at Facebook Live, you don't live in Virginia, your health department for your state usually has a state health department website that has those same links, similar information, because we looked at different states as well. They have the same information that you can go to. So state health departments are always a good site. And then the Center for Disease Control was a good site, just a global place to get information.
Thank you so much. This has been so much great information tonight. I hate that I've had to participate with you because I feel like I may have missed some of the stuff. So the great thing about Facebook Live is this feed will live on. So I encourage everyone to listen again,
Yes.
to take this information, share the link, let someone else be blessed with this information tonight, because you might save a life. On behalf of all the brothers of Beta Sigma, I definitely want to say thank you, Sarah, for coming on tonight.
Absolutely.
This has been a hard year, but this has been such an amazing topic. Not only have we lost dollars, we lost lives.
Yes.
And if we can all do just one small thing, like the things you mentioned, to help out and make our communities a better place.
Yes.
It was a thing done well.
Absolutely.
I want to thank everybody for joining us tonight. Again, we do this monthly, kind of in relation to what I just said. Our next one's going to come up on January 11th. It's going to be entrepreneurship. Many people have faced financial difficulties this year. Jobs have had to lay people off. Some of you might be on furlough right now. What better time to learn how to invest in yourself and find a way to support yourself and your family than jumping on our session on the 11th and learning about entrepreneurship. We have one of our brothers who started his own business. He's doing a great job with it. So there's going to be an opportunity for others to hear his story and learn a little bit more about that. Tiffany, again, thank you so much tonight.
Well, it's been a pleasure. Thank you so much. I appreciate the platform. I encourage you all, educate yourself, learn, get on those websites. And God bless you all. Have a wonderful holiday. Be safe, please. And just pass the word on, like you said. Save a life, make a sacrifice, save a life, educate yourself. And thank you all so much. Be blessed, be safe.
All right, thank you. Be blessed as well.
Thank you.
Good night. Good night, everyone.
Bye-bye.